Welcome to Prevention is Now. I'm Deb Bonner, the preventionist and community advocate for Prairie Center Against Sexual Assault in Springfield, Illinois. Sexual violence is a pervasive issue in this country, affecting millions of people every year, regardless of their gender, orientation, race, or age. It is an issue that the Centers for Disease Control and Prevention considers a public health issue. Now, for many years, much of the onus was placed on women to end sexual violence by modifying everything from their behavior to their wardrobe to the places they go and when they should even go there. Ultimately, this approach was proved unsuccessful in preventing sexual violence. Instead, the CDC has recommended a far more proactive approach that recognizes that preventing sexual violence requires addressing factors at all levels of the social ecology, the individual, relational, community, and societal levels. Two of the most promising approaches to ending sexual violence with this model in mind are bystander intervention, such as bringing in the bystander and coaching boys into men, both programs which Prairie Center does offer training in, and then also the social norms approach, or SNA. Both of these approaches are evidence-based in their effectiveness. As we've discussed before, bystander intervention is a primary prevention strategy for ending sexual violence in the community by identifying unhealthy behaviors that could lead to violent encounters and then safely intervening before sexual violence can happen. In this approach, ideally, as the more people stand up and serve as role models, the more social norms will start to change. So why are people hesitant to stand up? Well, in some cases, it could be because the current perceived social norms is incorrect, but as bystanders, we're unaware of that fact, and that can make it more difficult for bystander intervention to work. Now, correcting these misperceptions is where the social norms approach comes in, and to talk more about that is our guest today, Dr. Alan Berkowitz. Dr. Berkowitz is an independent consultant working with colleges, universities, public health agencies, military organizations, and communities to design programs that address health and social justice issues such as sexual violence. He developed one of the first rape prevention programs for men in the United States at Hobart and William Smith Colleges, and he is an authority in the development of social norms theory and has implemented several successful programs and has been published multiple times, including Preventing Sexual Aggression Among College Men and Evaluation of Social Norms and Bystander Intervention Program, Responsibility, a Complete Guide to Bystander Intervention, and Working with Men to Prevent Violence Against Women. Currently, he is working on the social norms approach as a strategy to prevent violence perpetrated by men and boys, a review of the literature with several of his colleagues. So, Dr. Berkowitz, you've been just a little bit busy. Let's just start with a brief overview of what bystander intervention is and what are some of the obstacles to it.
Sure. Well, first of all, thank you for that excellent introduction and welcome to the audience. My work and the work of people like me only has any meaning when people in the field who are in the trenches use it. So it's an honor for me to share with you my thoughts today and to hope that it will be useful to the preventionists who are listening. As you said in the introduction, the onus for preventing a problem should not be on the group that experiences the problem. It should be on other people who are in a position to prevent it. And when someone sees something problematic, whether or not that person does something, we call that person a bystander. They are either an active bystander, in which case they do something, or they're a passive bystander, in which case they don't do anything. And this is really part of everyday life. We've all experienced this. This doesn't only apply to sexual violence. This applies to racial injustice, homophobia, to religious prejudice, any kind of unhealthy behaviors. Anything that's happening around us that causes us concern has the potential to let us step in and try and address it or to stand by. And the research is very clear that most people want to do something but don't. Most people care and want to help, but they don't know what to do and how to do it. So the science of bystander intervention has developed as a way of teaching people safe, effective, and respectful strategies to intervene that overcome the different obstacles to us doing what we already want to do, which is be helpful and supportive. And as you mentioned, it's emerged as a science-based, cutting-edge prevention strategy for sexual violence prevention. What I want to talk about today is the intersection of social norms theory and bystander intervention, because we know that one of the primary barriers to whether or not someone will step in is knowing whether or not other people are also concerned, would respect them if they did something, and would support them if they did something. So it's not only a question of having the skills to step in, it's having correct information about other people and their degree of concern about the problem.
So these two really do work and it almost form a synergy because, like you were saying, I may see something that looks awkward, but as I'm looking around the room, I feel like I'm the only person seeing that. But some of the research that you've done has indicated that by and large, the vast majority of the people in the room may feel the same way I do. I just don't know it.
Right, and you don't know that because you're not aware of their thoughts. You're only aware of your thoughts. So you're thinking, wow, that wasn't okay what that person just said. No one else seems to be upset because you can't read their minds. And if we turned the situation into a cartoon where we could see what people are thinking, we would see that in many cases, most other people are also upset. Most people are thinking, gee, that wasn't okay. I wonder if anyone else is upset. No one seems to mind. And maybe one or two people thought the joke was funny or didn't mind the language used or whatever. But for the most part, there's extensive research from all over the world on multiple issues, not only violence, that when any kind of problematic behavior happens, whether it's racist, sexist, homophobic, or other prejudicial language, we now can say that most people are concerned, but that most people don't know that most people are concerned. And that includes the problem person. So if in your scenario, I'm the one making the offensive remark, I look around and I think, well, nobody minded, or, gee, most people seem to be okay with that. So I interpret everyone's silence as an encouragement. So here we have something that we know from the research, which is the misperception. That's a technical term. We do not perceive other people's concern correctly. We misperceive others' concern. The misperception of the majority causes them to be silent and not say or do anything. And the misperception of the offender gives him or her a sense of permission to keep doing whatever they're doing that is bothering other people without their knowing.
So how do we go about starting to change some of these social norms? Say when we get back to having parties, I'm at a party and I see a guy hitting on a girl and either she's just really not into it or maybe she looks like she's a little tipsy and really isn't in a good position to be able to offer any type of consent. How do we change social norms so people around feel okay to speak up and intervene?
So that's a typical scenario, and that's exactly illustrates the dilemma. In this case, we could say we're not actually changing the norm, we're changing people's perception of the norm. So most people are looking at the situation and thinking, that doesn't seem okay, or she's too drunk, or they shouldn't be going home alone together, or his intentions seem a little sketchy. It could be two men, it could be two women, it could be a woman hitting on a man. We would use a male on a female example because the overwhelming majority, well over 90% of the examples of this kind of violence are male on female. So we don't want to be gender neutral, but we can acknowledge that it could happen in any combination of gender identities or gender expressions. So the first step would be to tell yourself, well, maybe other people are concerned. Maybe I'm not the only one that's worried about this. And to find some other people that you can talk to and say, hey, do you see what's going on over there? I'm wondering if it's okay. What do you think? So now, rather than having only yourself to rely on, you have other people, and together you can decide on the best strategy. Maybe someone says, well, I know his friend. I'll go talk to his friend and let his friend go talk to him. Or maybe I'm friends with her girlfriend. I'll talk to her. Or we could talk about this later. There's a variety of different ways you can intervene. You can intervene directly. You can intervene indirectly. You can create a distraction. You can confront the person. Without going into those different options at the moment, what we want to emphasize is that in this scenario, you are most likely not alone in your concern, and you can have the benefit of other people's input in deciding how to handle it. even though you could handle it on your own. If you feel comfortable going up and saying something or creating a distraction or inviting her to go to the bathroom with you, right? There's many things you could do. You might feel comfortable doing that on your own without seeking the input or support of other people. But the important point for now, for the beginning of our conversation, is to realize that most of the times when we're concerned, other people are also concerned, even if we don't know that they are concerned.
Now, sometimes you see people trying to use fear to change social norms, and that doesn't work. For example, if you did a Google search and looked up, consent posters or something like that on the internet, you might get well, if she's drunk, it's not, you don't have consent and you could go to jail. And these things just don't seem to work. In fact, the National Institutes of Health said that programs that do use fear may even make the situation worse. Why is that?
So that's a good question. We can start from the assumption that we really care, we want to do something, we want to make a difference, and we want to get a reaction out of people. So a scary poster, let's take cigarettes. A lot of us might remember this is your lungs on cigarettes, and you see black lungs. It's natural to resort to fear because we want to get a reaction out of people and we want to get our attention. But it doesn't work for a number of reasons. First of all, most of the things that we want people to be afraid of are not likely to happen. So while it's likely that I will get a speeding ticket if I drive over the speed limit on the interstate, it's not likely that I will go to jail if I commit a sexual assault. Actually, sexual assault is one of the safest crimes you can commit because so few people report it. It's so hard to prosecute and investigate it. And very often juries are likely to blame the victim rather than understand that someone putting themselves in a vulnerable position is not a reason for someone else to take advantage of them. So fear tends to not work. The other reason fear tactics are a bad idea is they may make it seem like the behavior is more common than it really is. And one of the things that happens when we have something misperceived in a way that it seems more common than it is more people do it. Same for problematic behaviors around sexual assault. If we give it the wrong kind of attention, maybe we make it seem like bystanders aren't concerned and they don't want to step in and all these bad things will happen, as opposed to knowing that most of us are concerned, most of us want to step in, and most of us can step in a safe and respectful way. So anything that increases the overestimation is harmful. And in addition, fear tends to not work. There's very precise conditions under which fear will work, which is you have something you want to change, there's something you can do to change it, and you feel comfortable doing that. So I don't want to get a speeding ticket. I know how to drive slowly. I feel capable of driving slowly, and I do that, and I don't get a speeding ticket. The fear of getting a speeding ticket motivates me to change because those conditions are present. But those conditions are not present. Most of the times we use fear as a health behavior change strategy because we're scaring people about things that are very unlikely to happen, or we're scaring people in a way that increases the overestimation of the problem.
Now, instead of using fear, you've talked about using the science of positive information in modifying behavior. What exactly is that? And then how can we in turn use that to prevent sexual violence?
So that's a great question. What we call positive science, or the science of the positive, is simply giving a positive message. So since we're talking about sexual violence, I'll refer to the Men Can Stop Restraint campaign, which was one of the first positive campaigns directed at men. The posters were things, the theme of the campaign was, "My strength is not for hurting." So when she wasn't sure, I stopped. So when I wasn't sure, I asked. So in other words, we use social marketing strategies to disseminate a positive message about the issue that we're concerned with. If we want to transform a positive message into a social norms message, we need data. So now let's say, I'll give you an actual example. We go into a high school and we survey the boys and we say, How do you feel when boys trash talk girls? And we get back a statistic that 85% of the boys in this high school don't like it when boys trash talk girls. So now we put up a poster. 85% of boys at Prairie Hills High School don't like to hear boys trash talking girls. That's a positive message with a statistic. The statistic tells us what the true norm is, that 85% don't like it. Because when we do the survey, we find out that most boys don't like it, but most boys think that most boys don't mind. So there's the misperception. We call that pluralistic ignorance. The majority thinks it's a minority. The boys who don't like it are in the majority, and they think they're in the minority when they're in the majority. And the guys who are saying offensive things about girls are in the minority, but they think they're in the majority. We call that false consensus. You falsely think that you're in the majority when you're in the minority. And as you used the word earlier, these two things are synergistic, because when the majority thinks it's a minority, they tend to be silent. And when the minority thinks it's a majority, they tend to be more visible or outspoken. So, for example, with respect to sexual violence, we know that men who hold negative attitudes towards women of a certain kind have a predisposition to sexual assault. And when they think their friends share their negative attitudes, they are more likely to act on their predispositions. The belief that my friends agree with me gives me permission, or the belief that you will think it's a funny joke, or the belief that you don't mind if I use a certain offensive word about a certain group of people. The incorrect belief that other people agree with me facilitates me to express something in myself which I should be blocking. So the misperception, and this is a very extensive research on sexual assault perpetrators, that misperceiving other men's support makes men who are prone to assault more likely to assault and harass women. And knowing that their friends disagree tends to inhibit them. And this is true even in groups of men who have negative attitudes towards women as a group. The offender perceives the group's attitudes to be even more negative than they really are.
So as we're changing these social norms and getting these positive messages out, it makes it a lot easier for the bystander to feel empowered and to step up and do some of these changes. And you say to a degree that even the perpetrators are impacted, but are we really changing the perpetrators' actions themselves, or if we just taken so much of their power away that their impact is significantly lessened?
Well, to be realistic, it's probably the latter. We're probably not going to end this problem, but we're going to reduce it. Let's take a step back for a second. To do a social norms media campaign is very complicated and requires a lot of technical expertise. So we can talk about that later, how you do it, what you do when people don't believe your data. There's many challenges that need to be overcome that have actually been very effectively overcome in the state of Illinois for alcohol, where we have some model high school social norms interventions. So going back to the correction of the misperception, the answer is it depends. So let me give you an example. As a result of all of the bystander programs, including some which you are hosting in this podcast, we have more people stepping in and preventing the situation you described earlier. Two people are at a party or social event. A man is making moves or hitting on a female in a way that makes her feel uncomfortable, and somebody steps in and prevents it. So we could say we possibly prevented one sexual assault. Now what happens? If I'm the coercive male, I'm going to do it again another time. It's not going to prevent me from doing it again if you prevent me from doing it once, because I have a certain belief system that says if a woman lets me get in her space, if a woman dances with me in a certain way, if a woman or male comes back to my room and fools around with me, I interpret all those things as a green light, meaning that I have permission when I don't. So I will commit sexual assault over and over, as we know from the media. We know now from the last year or two of news that we have very well-respected people who have been sexually offending for decades and doing it over and over again. So bystander intervention requires that we go another step, which is we confront the perpetrator. We confront the coercive person. We let them know that their behavior is not acceptable, and we will step in if we see it again. It's not enough to save the target, to save the victim. It's not enough for a man to feel like he's the knight on the horse and he's riding in and protecting a female, which is a kind of paternalistic attitude. Of course, that's a good thing to do to prevent a sexual assault, but to really change the culture, we have to intervene against the problem individuals who are almost always men, who need to be confronted by other men, and the men who confront them need the support and involvement of their peer group, because when you confront a hostile male, he'll put you down, he'll accuse you of being gay, he'll accuse you of being jealous, he'll have all these ways of bullying you into being quiet, and you need to be prepared with the support of your friends to say, no, that's not okay, we don't agree, I don't agree either. Alan is right, I'm not interested in hearing you talk that way. So it's a concerted effort that requires men intervening with the men who are likely to do this.
And I think that's one of the interesting dynamic shifts that we've seen in sexual violence prevention, is that instead of it just being focused on women, this is a far more inclusive approach. There's a lot of focus on men because that's a group that we haven't typically involved in sexual violence prevention as much in the past as we are now. But really, everybody now is involved in the prevention effort.
It's a community-wide effort. When we frame the issue in terms of bystander intervention, everyone is a potential bystander and everyone has the potential to intervene. So a woman can intervene at a party and break up a situation as well. The understanding that men need to be involved has been growing for perhaps 10 or 20 years, and now it's become more mainstream that men have greater influence on other men than women. It shouldn't be that way, but one of the ways in which sexism expresses itself is that boys and men are taught to care more about what other boys and men think of them, to take their opinions seriously, to look for their respect, to get other men to look up to them. So the power of a man intervening against a man is very great, and we need to teach men to step up and to do that. And part of teaching men to step up and do that is knowing that other men feel the same. And also, we could say from a point of view of heterosexual men that sexual assault is bad for men as well, because it affects how women feel towards us. It makes women cautious about us. It also creates stereotypes of men that are negative for all of us.
Okay, Dr. Berkowitz, thank you so much for joining us. I think this is going to be a good place for us to stop today. Now, in our next episode, we will continue our discussion on the social norms approach and how to use it effectively in sexual violence prevention programs. This has been Prevention is Now. I'm Deb Bonner, preventionist and community advocate for Prairie Center Against Sexual Assault. If you would like more information on this program, you may call our offices at 217-744-2560 or send me an email requesting more information at dbonner@prairiecasa.org. Prairie Center Against Sexual Assault supports children and adult survivors of sexual violence through counseling and legal and medical advocacy in 11 central Illinois counties. We also offer bystander intervention training with bringing in the bystander and coaching boys into men, and we offer sexual harassment prevention training for business and organizations in our area. Our main office is located in Springfield, Illinois, with satellite offices in Jacksonville and Taylorville, Illinois. You can find out more about our services at our website at prairiecasa.org. This program is supported by a grant from the Illinois Department of Public Health and the Illinois Coalition Against Sexual Assault. Points of view or opinions contained in this program are those of Prairie Center Against Sexual Assault and our guests, and do not necessarily reflect the official positions or policies of these grantors. Thank you for listening.